Deborah Como. Joining me now is Dr. Sunil Bhopal, a paediatrician working in the NHS and an epidemiologist at Newcastle University, and Jeff Barton, General Secretary of the Association of School and College Leaders. And full disclosure, Dr. Bhopal is a member of the Labour Party. Good evening to you both. Jeff Barton, first of all, on the consequences of the lockdown on children, emotional, educational, social, future workforce, do you think not enough detailed analysis of the impact of that was done by everybody, including teachers themselves?
I think we may look back and see that. I also know that what we've heard is that the progress we made over the last 10 years in narrowing the gap between the advantaged and disadvantaged has disappeared in 6 weeks. So there is an urgency to this, which we absolutely get. You know, head teachers and trust leaders are used to managing risks, but some of those risks we needed to have articulated by the scientific community so we could reassure not just our staff, but also our parental body. And I think that today is a day when representing a trade union, that school leaders and teachers actually are showing that they're going to have a higher ambition on behalf of the nation's young people.
But maybe that should have been earlier, because we're now faced with you saying now we have a higher ambition at the very time the government's ambition for getting all primary pupils back to school before summer has gone. And I wonder, this whole question of risk, and we just heard it there, what risk are teachers prepared to take? It should be maybe only a metre, not 2 metres. What a massive difference that would have made if we come to that conclusion earlier.
Essentially, there are some things which those of us who were school leaders, I was a head teacher for 15 years, that we know about and we can control, but we were reliant on the guidance from the scientists and the medical experts. If they say that you need to keep children in bubbles of 15 children, then it's no surprise that the great promise that we had from the Prime Minister couldn't be delivered, because you couldn't have every child back for 4 weeks at the same time, because you could only have half a group at a time, unless you were going to double the number of classrooms, unless you were going to double the number of teachers. So I think it's important that we recognise that what teachers will do is everything we can on behalf of young people, but we do have to follow the guidance that has been given to us by the government. And that, it seems to me, too often has lacked an overall ambition on behalf of children, unlike, for example, in Wales, where they're saying every child before the summer holiday has to have some experience back in school. Well, why shouldn't that be good enough for every parent with their child in England as well?
So, Dr. Bhopal, do you think the very terms of the discussion over schools were wrong from the start?
Thank you very much for having me on. I mean, I think we have to take a little bit of a step backwards here and say, well, children are at minimal risk. It's one of the few things that we can be really thankful about through this pandemic. It's a way that this pandemic is different to those that have gone before, maybe the influenza pandemic 100 years ago. But we have to acknowledge that they've suffered greatly through the nearly 3 months now of lockdown and extreme social distancing policies. This binary discussion, school, no school, 1st of June, no 1st of June, I don't think it's helped children. And I think the question now, and I would echo the really brave and principled words of the Children's Commissioner, who said, do we, for England, do we have the leadership, the ambition, the drive across government, but also across the children's sector, not just education, but health as well, and more broadly into social care and on onwards? Do we have the ambition to put children front and centre and really try and create a better childhood?
To be fair, we've only more recently had a number of different scientists and the WHO and so forth talking about the idea that children were most unlikely to spread that, and actually teachers in the classroom were actually safe, as safe as they would be outside.
I think you're absolutely...
Yeah, sorry, carry on.
Oh, well, I think you're absolutely right to point that out. And, my own work as a paediatrician, I was there in the hospitals January, February, as we went into March, and we didn't know what was coming. So I think what we have to recognise and what we have to do now is make that mindset shift. And you're rightly pointing out that it is a shift in mindset, not just from previous pandemics, but through this one as well.
Do you accept now, Jeff Barton, that this is not about safe and not safe? It's about other decisions about risk. So, for example, it's extraordinary in a way to think about it that families will take their kids to the beach and maybe sit close to others, but they'll be more concerned about their kids going into a classroom. The terms of safe and not safe are so relative that teachers now should be encouraged, as you say now, you've got to a position, teachers should be encouraged to do different things, perhaps, we're being told that head teachers can take the initiative. So maybe there should be some Saturday education. Maybe there should be outdoor education. Maybe there should be education in destitute churches. Maybe it's a time for teachers to take the lead in the absence of a national plan.
Well, a couple of points there. First of all, none of us has ever talked about safe. When I was that head teacher for 15 years, we knew the school couldn't be guaranteed to be safe. I would lose sleep when a ski trip went out, for example. This is about managing risk. And what we needed was very clear guidance about how you manage that risk. We've now got that. And it seems to me that what I'm hearing today from our members, and I represent 20,000 or so heads and deputies, is what they're saying is, well, what might we now do to give every child some experience where they come back into school a little bit in the way that you're suggesting, so that somebody assesses their well-being, assesses what progress they may or may not have made whilst they've been at home, plans the curriculum for them. And if that then means, in the way Justine Greening says, that we bring in extra resources to teach them after class or on Saturday mornings, guided by what the teacher's assessment of the child is, that would be an extraordinary positive national mission, and it would be a real sign of ambition on behalf.
And do you think that teachers would be prepared to do that, for example, over the summer? Do they have that, the idea of a kind of civic duty towards children? Do you think that would happen?
Teachers have definitely got a civic duty. Teachers have been continuing to work in the background now, but the Secretary of State has ruled out the notion of teachers doing that over the holiday. And what I'm saying is, a bit like in Wales, why don't we get every child to have some experience with their teacher to assess them, to do the planning for September, and then let's use, in the way that the schools commissioner, the children's commissioner has said, our school sites for a range of other activities to re-socialise children, ready for some kind of normality when we finally get to it.
But we now have a situation where, Sunil, your father has actually, who is also a doctor, has actually tweeted out, get these kids back to school, don't worry about me, I'll be fine.
I think we have to recognise the total hardship that we've put children through. This doesn't just affect children now. It affects it. There will be, unfortunately, for some of these children, lifelong impacts of what they're suffering through. His message really struck a chord, and I think it was notable that what he said, it reverberated with people. I think we need to manage risk, as has been discussed. And, I really think we need to not just think about schools. We need to broaden out to the sorts of bold, ambitious things that we've talked about, including opening up private spaces, opening up.
Thank you both very much indeed.